We are considering, and there's going to be some talks in other sessions about how the cancer plan is making progress, of how we look after our increasing number of cancer survivors long term. We can't carry on looking after them in the same way as we do now. So we need to think very carefully about different models of care. That is going to change the culture of care, considering things such as risk stratified follow-up, earlier discharge, shared care with GPs, and increasing the role of clinical nurse specialists and other healthcare professionals. So nurses are going to have an increasing role in looking after long-term cancer survivors and probably more responsibility. So we need to think about upskilling them, and we've been working on a workforce toolkit to consider, and competence framework to consider what skills they need to do that. Now, mainly nurses in oncology tend to be focused on diagnosis and treatment and in the early phases, but we've got to increasingly start thinking about getting patients better and optimising their health and well-being. And this is something that we're going to be developing more and more over the next few years. So we are aware that being disease-free is the ultimate goal, but it doesn't necessarily equate to living well. So what we are increasingly wanting to do is deliver patient-centred care, considered who may do that, who the best person to do it, when we might do it. And that's really asking patients and working with them what concerns them and what can we do to help. And it's a multidisciplinary responsibility. That includes the doctors as well as the nurses and other healthcare professionals and many other agents besides and patient charities. But first of all, it's about finding the time to ask the question, and that's really the critical challenge within oncology care at the moment. So one of the most exciting sessions beyond our reality of treatment consequences is going to be the NCRI Spotlight Session, where we are going to be launching the top 10 tips for research in living with and beyond cancer. So I've been fortunate to be one of two nurses on the steering group working with patients and the NCRI team to identify the top 10 research priorities, and they're going to be launched on Tuesday morning. And we're very excited about that because this is an area where has been very poorly funded over the years. And so we're hoping that these research priorities, working with our partners and the key research charities and research councils, will start commissioning this research. This is research that issues that really matters to patients who want more evidence about the things that concern them and how we may best look after and support patients with those problems.